Hello, so today we're in the very last standard of strand 4. So the endocrine system makes up standards 7 through 9. This is the last of those standards. So we're going to talk about diseases and disorders today, and these are the ones that are outlined in our curriculum. So we will be covering just these. So don't think that there aren't other diseases and disorders. There are just some that they prioritize and say, let's teach them about these. So that's what we're going to do. Okie schmoky, clickety clack. Okay, so tried to just pick an easy little picture for people to decipher. This is the type of diabetes that a lot of times is known as juvenile diabetes or insulin dependent diabetes, and it comes about because there's an autoimmune reaction that happens in some people's bodies, the people that have type 1 diabetes, that will attack the cells that create insulin. So they're working from an insulin deficit. And that's a problem because if you look at the cell, and I again tried to pick a real easy picture to decipher, insulin will act as kind of the key for the door to open. So insulin has to bind with the receptor. So he's got to plug in here. Once that happens, then the channel will open for glucose to enter. We need glucose in the cells. So if you think about everything that needs to happen within a cell, energy has to be there for that to happen. So we're talking specifically about sugars, and insulin is just kind of the gatekeeper to let the glucose in. So if you have problems with insulin and insulin development, then that's going to be a problem for energy for the cells. Okay, so I wanted to make sure I pointed out a couple of differences here so you can have someone who's low blood sugar. Okay, so this picture kind of shows you here's some red blood cells, here's the glucose, and here are some white blood cells, and there's just not enough. Hypo means low, okay, low sugar. And if you look at low sugar symptoms, they'll sweat, they're pale, they're irritable, hungry, they're not very coordinated, and they're sleepy. So when we're in school, I have that cute little fridge right behind my desk. I always keep applesauce in there. And the reason I do that is because inevitably every year I've got a kid that has some issues with their blood sugar. And I've always told kids, if you need help, come see me. I have applesauce, because I don't want to give you I don't want to rush the system, but I also want to make sure that we don't get into a place where you're in a bad way, I guess. Most of the people that I see don't have diabetes. They just kind of have low blood sugar, and they have these symptoms. So a little applesauce. This is normal, so you can kind of see they're just a little bit more distributed here. And then hyperglycemia is too much. You have too much glucose in the system. So on the hyperglycemia end, when you have too much in the system, then you're going to have dry mouth, you're thirsty, you feel weak, there's a headache happening, you can get blurry vision, and your body's going to want to urinate more frequently. So that's to remove waste. They can actually measure it. So in fact, we'll talk about another kind of diabetes in just a second that they test for. Okay, so type 1, if you noticed on your sheet, I've asked you to go, okay, here's the chart. Here's type 1 diabetes. I need you to know what the definition is, cause, and then we've got, on the next one, signs, symptoms, and I'm going to abbreviate that from now on with S/S, and treatment. So I thought this little infographic was kind of helpful, so you can kind of see what kind of statistics are we facing here? So about 1 in 500 people in the United States has this condition. So here are the signs and symptoms that we kind of already talked about a little bit. So increased thirst and urination, increased hunger, fatigue, blurred vision, numbness or tingling in the feet or hands, sores that don't heal. So with diabetes, if you can imagine, if we're not getting nutrients to the cells, a lot of times the cells that are the worst off, I guess, is the ones that are farthest away, like your toes and your feet. Can have to do with circulation a little bit, but we used to be next to, I think I mentioned this in class, with the wound care clinic, and people would come in there with some pretty gnarly wounds, and a lot of times they were diabetic, and they weren't managing it very well. So typically type 2 is what we would see, because they were overweight and they kind of just didn't take care of themselves all the way around. This one's more like you can't predict how this hits people, because sometimes it seems like the healthiest kind of person that ends up with type 1 diabetes is just a genetic condition that they inherited. But yeah, with the wound care, they would end up with cells dying so much that you end up getting necrotic tissue in the toes, and eventually they'll get to the point where they'll just cut things off. So like cut off toes. So for type 1, really what they do is they have to inject insulin because their body's not making it the way that it's supposed to make it. Okay. Then we get to type 2 diabetes. Well, this is one that is more controllable, and there is a genetic component. However, if you eat right and exercise and pay attention to your sleep and your stress, those are going to be ways to battle this a little bit. So the definition is over here. It's a lifelong disease marked by high levels of sugar, so hyperglycemia usually, in the blood that occurs when the body doesn't respond correctly to insulin. And that could be because we flooded it for so long. Your body gets fatigued. So you flooded it. If you like to eat donuts and candy and cakes and you keep doing that, and you've got so much sugar and it's just overwhelming to the system, your pancreas can be a little bit like lethargic and go like, I can't anymore. So 30 to 40% of Americans show signs of pre-diabetes, which means like they're on the cusp. So pre-diabetes, they would get some kind of a measure of their glucose, and it would be high. Usually they get a fasting value, and I'm pretty sure the number is about 120 for a fasting value. I think it's 100 ideally. You don't want it to be over 100 if you're fasting. But I think they give it a little bit of leeway for people that are a little pre-diabetic, like, okay, if it's under 120. But it's related to the sugar in your blood, and so they'll test it. So 7.2% of us Utahns have it. This is from the University of Utah, where I graduated. And then it's increased by obesity and inactivity. And here are the things that you can do. Lose weight if you need to, which I don't think there's anyone that I have in my classes that needs to lose weight. But if you're mindful about what you eat now, then you won't have to get in a situation when you're my age going, okay, now I need to lose at least 7% of my total body weight. You need to exercise 30 minutes a day. You pick up that habit here. I'm telling you, the patients that we saw at the clinic who picked it up in high school are the ones that stick with it their entire lives. It's not something you're like, well, I'll exercise when I have to. Guess who does that? Maybe like 1%. Really, like, adults are unchangeable. We're kind of a meep generation. Or not even our generation. It's just once you get past the whole, like, your frontal lobe's formed and you've made your habits. I don't know. There's a good friend of mine that took off 100 pounds of her weight. She saw a video of herself one time and didn't like what she saw, and she just tackled it. She started exercising, she ate right, and I'll bet it's 15 years later and she's kept that weight off. So it's doable. I don't want to say it's not doable, but you don't want to get to the point where that's something that you need to face. So causes are being overweight or obese. So you can kind of look at the BMI scale. If you're just over like 24.9 on the BMI scale, if you're at 25 up to like 30, it's considered overweight, and then obese after that. So you want to make sure to keep your weight at a healthy level, and do that with good nutrition, and make sure you're exercising. Genetics do play a role, so if that's in your family, then you need to be especially good about making sure your habits are in check. Okay, signs and symptoms. I'm just going to go with the picture because I thought this was a little bit better than just reading them out here. So vision problems, they'll get some fungal infections that they're having a harder time fighting. Unexplained weight loss in some cases, numbness of hands and feet. A lot of times it's because you're just getting rid of the extra glucose because your body's like, I can't do anything with this. Frequent urination. So again, we're just trying to get rid of stuff. Constant hunger And the reason you would be constantly hungry is because your cells are like, what do you want us to do? You're telling us to, walk around and, whatever it is that you do throughout a day, but you're not sending us any nutrients because that, the insulin is not, getting into the cell and allowing that channel to open up. So healing is slowed. That's kind of what you're looking at. So treatment for that is insulin, drugs, clean diet, exercise. So really think about right now, just be like, how's my health and how could it be better? And if you tackle it now, I promise it will change your life. Okay, next disorder we'll go into. This one is related to growth hormone. So this gentleman here has gigantism, and this one has a form of dwarfism that we're going to talk in a minute. So there was a point at which, like, he was the largest one. I think he's still alive. I wish I could remember his name, but I think he's still alive. I'm not so sure about this one, but it's an overabundance of growth hormone. So they make too much growth hormone in their pituitary, and they just grow extra large. So this is Andre the Giant. If you've ever seen Princess Bride, he's that big dude in that. These are some of the signs and symptoms over here. And if I kind of want you to think about, like, there was one where I was like, that would make sense. Maybe it's not on this slide. One of the things I did see is, like, you would ache. And if you've ever had, like, growth pains, I would imagine that these guys face some pretty serious. Treatment for this, they can do some surgeries. They use medications. This is genetic. There's not a ton that they can do, but they can start to address at least, like, okay, we're seeing these larger features. Now we need to go and address this pituitary and see if we can't go, a little too much there, buddy. Okay, and on the flip side, we have dwarfism. So if gigantism was from too much growth hormone, my guess is you can go, oh, well, this must be not enough growth hormone. And that is basically it. This is a genetic condition, just like gigantism is. Nothing that can be controlled on the part of the patient. Signs and symptoms. So if you look at their facial features, they're a little bit different. Their heads generally are larger with the prominent forehead. They have a flattened bridge of the nose. So definitely characteristics that you could say unique to dwarfism. However, there are multiple kinds. There's one that makes up like 70%, which is probably what we're most used to. But I think on this slide, I wanted to make sure they're defined as an adult that is 4 feet 10 or less. So they didn't quite make 5 feet to be classified as dwarfism. So treatments are aimed at reducing whatever complications exist. They can do things to, like, help stabilize the spine, and they do induce some hormone therapy, which is, endocrine systems, all about the hormones. Okay, next one that they wanted us to cover is hypothyroidism. So hypo means low or below, and this is when we say, like, low, high, so this is low hormone coming from your thyroid. So hypothyroidism is a condition in which the thyroid is not producing enough of its hormones. So we have T3 and T4. There's also, like, a TSH in there that we haven't really talked about, but that's basically hypothyroidism. I'm sorry that picture is, like, blurry. It didn't look that bad when I was looking at it earlier. But here are the signs and symptoms. So I like the pictures when we can kind of get a visual for this. So they're cold a lot. A lot of times they have a receding hairline. They'll have some bulging around the eyes from edema. There's a dull expression. They're fatigued a lot, so tired a lot. Slow speech. Anorexia can be something that they're facing. So sometimes that's because they have unexplained weight gain, and so they're trying to just figure out a way to figure out their body. But some other things that you might see: slow heart rate, They gain weight. They have a lower level of consciousness. That's what LOC stands for. They can be constipated, muscle aches, weakness. Just not fun. So this will be a thyroid hormone replacement therapy. So that's hypothyroidism. We kind of hit on this though, just so we were talking about the middle-aged women last time. I kind of hit on this when we were talking about the thyroid, and yeah, these ones are hard to deal with if they're wanting, like, they have goals, they want to get fit, and they're struggling because their hormones are off. So the hormones made a play, and they're trying to get to the shape that they want, and a lot of times working so hard. It's not like it's not for lack of trying, it's because their hormones are working against them a little bit. Hyperthyroidism is the flip side. So this is when this little hormone that's at the base of your neck is making too much thyroxine from the thyroid. So too much. I'm going to show you the next one because I've shown you two pictures that are like meep. They're all blurred out, so I can see there's a heart. Looks like maybe headaches with the light. I don't know what that's. I don't know. Sorry. We'll go to this one. Here are some signs and symptoms of hyperthyroidism. So these guys are hot. They have fine, straight hair, bulging eyes, facial flushing, enlarged thyroid. So sometimes it kind of bulges out. Tachycardia. So in the last one, bradycardia. Now we're at fast heart rate. Increased blood pressure, weight loss, muscle wasting. So their weight loss is not just due to fat, they're losing muscle tissue as well. They've got swelling, and especially like if you think of gravity, it's swelling especially at the lower parts of the body. If we get too low, so if we're losing lots of body weight, we're losing fat a lot, then if we get too low for a girl, if you go below like 12%, or like 12% is essential body fat for girls and women. If you go lower than that, you lose your menstrual cycle. So if you take sports med, we talk about the female athlete triad. One of the corners of the triangle is amenorrhea, and it happens because they've lowered their calories too much. They can get diarrhea. So remember, the last one was constipation, tremors, and finger clubbing. So again, this is another one where maybe a person's doing everything right, but their hormones threw them off. So treatment includes radioactive iodine. And one thing that is something that you should know is your body does need iodine, and not in huge amounts, but it can help with your metabolism if you have the salt that has iodine in it. Medications can help with this, and sometimes they do surgery on the actual thyroid itself. So that is it for diseases and disorders. Today is Thursday. Well, it's Wednesday when I'm making this. Thursday for you, and that means it's the weekend until I see you next time. So on Monday I'll have some new content for you. Thanks.